CareScan Plus uses reliable and established barcodes that major industries already rely on every day. Capturing this data will help to transform standards of healthcare and directly influence positive patient outcomes. Care episode data is collected against patient, product, location, staff, and procedure. CareScan Plus data is instantly available for reporting and auditing purposes.
Quite often, if we just let things drift, we don't get very far, so it's helpful that the Department of Health wanted to mandate this for the purposes of patient safety, for the standardisation of clinical practice, removing that unwarranted variation. We need to integrate whatever we do with our single version of the truth, the electronic patient record. There will be additional benefits such as inventory management, but that will be a byproduct of point-of-care scanning for the purposes of safety and accountability. Then ultimately how we can then prove that, but also share best practice where that's appropriate and necessary. We didn't want everybody to have literally the Batman utility belt. We needed one product, one tool for one purpose that then could be used for many other purposes. So we wondered what we could produce ourselves. We went back to the drawing board. We came up with quite a rigorous outline of the things that people wanted. We wanted to consider the process and the workflow rather than just the technology, but fundamentally how people, process and technology would align to develop the outcomes that we needed.
CareScan Plus data will facilitate an immediate response to both patients and care providers in the event of a Class 3 product recall, thereby enabling assurance to be provided. CareScan Plus can also identify unwarranted variation that can cause inefficiency and risk, so that these elements can be targeted and eradicated to enable changes in clinical practice if necessary.
Comparing data instances to the surfaces of an unsorted Rubik's Cube helps to illustrate the ad hoc manner in which CareScan Plus can capture data. CareScan Plus has been designed to be easy and intuitive to use. It requires minimal training and impacts very lightly on tasks already being undertaken by staff. Simply scan products and equipment used during the care of patients. CareScan Plus will then transform this data into information with specific focus on safety, cost and waste, efficiency and planning, training, and audit and investigation. And importantly, it can be used to identify unwarranted variation or alternatively exemplary processes that we should harness and replicate.
During the use of CareScan Plus, data is captured that shows which patients have received care, who provided the care, in what locations, on what dates and times, and also what products, implants and where applicable medical equipment was used. This data is essential if we are to effectively track and trace products and support recalls.
Various different entities feature in the care of our patients. The GS1 open standards help to identify all of these. We have patient wristbands, staff identification badges, global location numbers, along with additional standards to represent medical instruments, products, product packs, and surgical implants. All of the items mentioned can be captured via a simple scan.
The one problem we've had perpetually in the NHS is the wrong insertion of nasogastral tubes. How can you help that? Well, I didn't know. But happily, there are some smart people up in North Tees who do know. And you can't actually prevent a never event, but what you can do is help a doctor to stop making bad decisions. And what happens in North Tees is that if you scan the GS1 barcode on a nasogastric tube, it takes you to the 2010 patient safety alert. It then says, have you carried out a pH test? Because it's pretty obvious, because if it's in the right place, it's going to come up with an acid reading. That doesn't stop a never event from happening. But what it does do is it helps clinician colleagues to have to think 3 or 4 times to keep pressing that button to say they've definitely done it. And it holds them accountable. And that, I mean, we are still having never events today on nasogastric tubes, reducing unwanted clinical variation.
You know, we need leaders at every level, but this is not a technology project. I think Matthew said that. We've got to view this in terms of what it is. It needs to be clinically led. We need the clinical champions, we need the clinical leaders to embrace this, because it's about quality, safety, as well as it will provide lots of efficiency going forward. And that research database that we talk about creating is really rich, and that in itself can provide real value for the NHS going forward. So the clinical leaders and clinical champions in our clinical networks absolutely vital.
Why use CareScan Plus? CareScan Plus is built by the NHS for the NHS. It provides affordable healthcare solutions and improves patient safety. It reduces waste and increases the accuracy of orders. It ensures traceability of products and surgical instruments, which allows accurate and targeted recalls and reduces medical errors. It allows clinicians to determine improvements and spend more time with patients, making hospitals better and safer. Right product, right place, right time. CareScan Plus.